Yes, I'm going to talk about red meat and health. Red meat, what I often call the third rail of nutrition. Don't touch that subject. But we are going to touch it today. And we're going to start, I just want to start with, since it's breakfast time, this is what used to be the breakfast of champions. I don't know how many of you had a bowl of cereal this morning for breakfast. This is what, when Charles Dickens visited the United States, he said was a typical breakfast in the United States during his trip. This was in 1861. I mean, times have really changed. It seems almost unimaginable that this could be true. So now we live in a time when red meat is really, like, there's sort of this idea that red meat is the worst thing you can eat, and you might as well just not eat red meat. Like, what is the point of eating red meat? Because it has no benefits and it's probably going to kill you. And so where does that idea come from? That's what we're going to talk about today. And I want to say this idea has really spread to the highest levels. That's Quim Williams, who was the immediate past president of the American College of Cardiology, a vegan. Said the best diet that you can eat for your heart is a vegan diet, no meat. So, and Harvard is very much behind pretty much a vegetarian diet, if not a vegan diet. So, I mean, this idea has really reached the highest levels of nutrition and expertise. My own background, I did indeed grow up in Berkeley, California. That's why I'm wearing my bell bottoms today. I came to this as a journalist. I am a journalist. I got interested in the subject of dietary fats, and I started researching this, and I really had no preconceptions when I came into it. I was, in fact, as Sean mentioned, a vegetarian for more than 25 years, and for me, I was not a strict vegetarian. I had fish and I had chicken, but the one thing I definitely did not eat was red meat. Like, I would never eat red meat or butter. And then I took this deep dive into this subject on dietary fat, and after almost a decade of research, I put a piece of meat on the cover of my book. I never thought that I would do that, but I was really just driven by the data. You know, I'm a journalist. I go where the data goes, and this is where it led me, which is an extraordinary journey. So, so that's my book. I also want to say they typically do this in scientific meetings to disclose. I have no ties to the meat industry. I'm not funded by the meat industry. I don't have ties to any industry. Okay, so let's just talk about some kind of facts up front that are kind of startling. Because we're told that red meat is the cause of obesity, diabetes, heart disease, right? Everything. All those conditions have risen in the last 20, 30 years dramatically, right? And heart disease, even though it's gone down, is still the #1 killer in the nation. During that time, our consumption of red meat dropped precipitously. If you look at beef, is not on here. Beef has dropped by 34% since 1970. Oh yes, it is on there. And it's poultry and chicken that have dramatically increased in the last since 1970. This is since 1910. And again, you see red meat has not increased very much since the beginning of the century. And what has increased is poultry. And then this is a chart. This is a chart from my book. It goes back to 1800, and the way it does that is there's a really fascinating book called Putting Meat on the American Table, which by a scholar, not nutrition, he's a historian, and he went back and looked at all the records, the marketing, the records of sales, and how much meat was allotted to slaves, and he looked at all kinds of data, and he came up with this number that shows us that it seems as if we ate 50 to 100% more meat than we do today. In fact, slaves were given more meat than we are told to eat today. But this is what, this is the main outcomes that are tied to meat, the main diseases that we're told meat causes. So let's look at each of these in turn. And first, before we do that, I have to kind of take a little tangent and introduce this big word, epidemiology. How many of you know what epidemiology is? Oh, excellent. You must have had your breakfast of champions. So I just want to explain it. Epidemiology is a kind of science. It's also known as observational studies or prospective cohort studies. It's a kind of science that can show associations between two things. But it's meant to generate hypotheses, right? It's not meant to be proof. It's meant to generate a hypothesis. If coffee drinking is associated with heart disease, let's go do an experiment on that. And to do an experiment, you have to do an actual test of that hypothesis, which would be a clinical trial. So a clinical trial can provide proof. Epidemiology, see, I can't even say it, cannot provide proof. So what is epidemiology? It's where they take a large group of people usually, and they follow them over time. Again, they show association but not causation. Okay, so this is the problem with epidemiology. There's something called false positives that turns up. So here's a chart that shows if you don't want to get divorced in Maine, you need to reduce your consumption of margarine. Association. Here's another one. If you do not want to get breast cancer, you better stop using the internet. So these are associations. They look very convincing, but they're only associations. They're not causation. So, and epidemiology, so that's one problem with epidemiology. Another problem is they rely in nutrition on food frequency questionnaires. Here's an example of one. And they ask people to usually it's on the better ones, they use about 200 questions and they ask you what you've eaten over the last 6 months. Some of them they ask you what you've eaten over the last year. And then they assume your diet doesn't change for the next 10 years. But this is very unreliable. I mean, if anybody asks you, how many glasses of wine did you actually drink last night? Do you think you would give an honest answer to that? So the first thing is people just lie. They just lie, even if they want to be truthful, they don't remember. I barely remember what I ate yesterday, much less 6 months ago. The easiest example of epidemiology is like, how many people drink milk? That's an easy thing. Raise your hand, not raise your hand. What kind of milk do you drink? Easy thing to narrow down. I drink skim, you drink whole milk. But it gets much more complicated very quickly. Like, how many of you remember how many times you had ribs over the past 6 months? And now I want you to tell me in cups, which is what's on the food frequency questionnaire. I mean, what do? Grind it into a blender and measure it with cups? So, and also those, ribs, some of those are made with highly sugary, syrupy rubs, and others aren't. That sugar makes a big difference, but you don't capture that in a food frequency questionnaire. And then there are all these other things. How many peaches, how many pears, how many grapes, how many cups of grapes did you eat over the last 6 months? I mean, you can begin to see how unreliable this data is. And one other thing, did you have lasagna? Yeah, yes or no, that's your only question. How many times a week? Well, how do you make lasagna? I make mine, I don't put a lot of pasta on mine, but other people load it up, and what kind of meat did you use, and did you fry it in oil, or did you fry it in butter? I mean, there's so many variables that are not captured. So that creates this very, very unreliable data set. There are also, in epidemiology, confounding factors. So here's the thing about finding that red meat eaters are less healthy. There are all these other factors about people who eat red meat, lots of red meat, other than like the paleo people out there who are trying to be healthy. Most people who eat red meat are people who 100% ignore their doctors over the last 50 years. Every doctor you go to will say, eat less red meat. So if you're the kind of guy who's like, yeah, doc, and then he goes out, and then you drink a bunch, you drink a bunch of beer, and whatever you're doing, you are not paying attention to orders. So red meat eaters are less likely, they're just less likely to do any number of of things that make them healthier. They tend to be fatter, they tend to have lower education, smoke more, drink more. So any one of those factors could explain why red meat eaters seem to be less healthy. We don't know. And epidemiology, you can never know, because epidemiology cannot measure all these things. They don't actually, they can't, if they measure them, they can't adjust for them properly. So if you want to see the full critique of epidemiology, and this is just such an important issue because it really underlies so much of our misunderstanding about science. And it's really, I would take a picture of this and I would go and watch this hour-long talk by Stanford professor John Ioannidis, who is, he is the leading, he's the leading person who, his work on nutritional epidemiology and the critiques that he does is really, I think, the best. He's really the leader in this field. And he gives a wonderful talk here. And he has many, many papers that you can read. So that's epidemiology, why it's so hard to trust epidemiology. Versus clinical trials. Clinical trials do show cause and effect. You take to a group, this part of the room, I give you a pill or I tell you to eat a hamburger every night. That's the intervention group. This group, I say, don't do that. Just have your normal diet. And therefore, I'm assuming that everything else about you are the same. I don't have to worry about confounding factors. That's an experiment. So, and at the end of that, this is the only kind of science that can show cause and effect. If you hamburger eaters, all get diabetes or get twice as much diabetes as this group, I know that meat was probably the factor that did it because that's the only thing we changed. We only changed that one thing. So, and this is, so you would not prescribe a pill to your patients. The FDA requires that the pills that you prescribe to a patient they have to go through a clinical trial, right? And you wouldn't prescribe a pill to a patient if they hadn't. Why would you do the same with diet? Which is pretty much what we do when we tell people not to eat meat. I think I'll skip through that. This is just one more fact about epidemiology. When it's actually tested in clinical trials, when nutrition epidemiology is tested in clinical trials, it's shown to be right 0 to 20% of the time, which means that 80 to 100% of the time, epidemiology is wrong. Okay, now let's get to the point that all the data that shows red meat is bad for health comes from epidemiology. Like 100% of it all comes from this really, really weak science. So, and it's important to say there is one exception for epidemiology, which is that it did find that heavy smokers had a 15 to 35 times more likelihood of contracting lung cancer than never smokers. That was a success in epidemiology where an association was used to impute causation, and that was okay, because look at the size of that association, 15 to 35 times, all right? Remember that number. Sorry, let me skip ahead. So, oops, I'm missing a slide here, but in nutrition epidemiology, those numbers are tiny. And anything less than 2 or really 3 in terms of, so that 15 to 35 is what's known as the relative risk. Anything under 2 is just considered not reliable because of these other factors, because of the confounding, because of the weakness of the data. So you really can't use any kind of relative risk under 2. Okay, so now let's get to the heart of it. Back to meat and health. Here's the numbers for meat and diabetes. This is why the head of the school, Tufts School of Nutrition, says meat causes diabetes, and he does it on the basis of this paper. His relative risks are 1.15 and 1.19. 1 means no effect. Remember, 15 to 35 was what we thought we could rely upon to say that cigarettes cause lung cancer. Smoking causes lung cancer. These are tiny effects for red meat and diabetes. And I've conversed with the author of this paper, and I showed him this chart. I was like, how can red meat cause diabetes? I feel like all you need to do is look at this chart and say, that is just completely implausible. Not only to mention the fact, like, how does red meat cause diabetes? What causes diabetes is excessive glucose in your, excessive exposure to glucose. And red meat doesn't have any glucose. So what is the mechanism by which red meat causes diabetes? So that's red meat and diabetes. I think that chart is just like, that hypothesis, goodbye. All right, so what about red meat and colorectal cancer? I think this is probably the most prominent claim that is made against meat because it was made by IARC, which is part of the World Health Organization. This is a decision that came out, I think, in 2016, and they decided that this is their scheme of how carcinogenic something is. They decided that fresh meat, there was limited evidence or probable cause that fresh red meat caused cancer, colorectal cancer, which is cancer, and then processed meat, like bacon, what had convincing cause of causing cancer. That's number one. That's in the red zone there. That's the equivalent. That's where cigarettes are. So red meat is as cancer-causing as cigarettes, according to IARC. So what was the evidence that they used for this? Well, this is the paper that came out when they announced this decision. And look at those relative risks. 17% increase. Well, they don't have the relative risk on this paper, but it's like 1.18 for processed meats, 1.18, and for red fresh meat, it was 1.17. Those are the numbers associating the meat with cancer. Tiny, 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 and not greater than 2. Remember, 2 is a threshold above which you can even consider something to be maybe a decent hypothesis. And again, this is this is data to generate hypotheses, not to be used as proof for them. Those are the numbers. Good that I remembered them correctly. Okay, is this a strong association? No, it is not. And again, so this is sort of a pyramid that shows you how you're supposed to prioritize evidence. You put these epidemiology towards the bottom. You can see randomized controlled trials are up at the top, right? That's a higher quality of evidence. Were there any randomized controlled trials on red meat and cancer? In fact, there were. So those are the studies reviewed by IARC, were those low ones down there. There were clinical trials on red meat. There were 2 of them, and so now I have to tell you that I actually know quite well one of the panel members who was one of the IARC panel members. There were 23 or so, and his name is David Klurfeld, and I can talk about what he said because he published it in a paper subsequently. And he sort of gave me the inside scoop on what happened in that meeting. And he said one of the things that happened is he tried to present these clinical trials on red meat and cancer, that's specifically on colorectal cancer. And he said they would not accept it as evidence for whatever reason. I mean, I think, IARC almost always deals with carcinogens that can't be tested because they're too dangerous. They can't test them in a clinical trial. Like you can't, so you can't do a clinical trial of cigarettes, right? Because it would be considered unethical. So maybe they just aren't used to clinical trials, but these are incredibly important because they are a form of proof. Anyway, this is one of those trials, the polyp prevention trial funded by the National Institutes of Health, specifically looking at colorectal cancer, and they found absolutely no effect of red meat at all. Relative risk of 1, which means 0 effect. Women's Health Initiative was the other trial on nearly 49,000 women. So this trial changed a lot of things in the women's diet. It reduced fat, it reduced saturated fats, it increased whole grains. So one of the things it said is, please reduce red meat. So, and the women did. They significantly reduced the amount of red meat that they ate. And they did this, well, by 20%. And they were on this diet for 8 years, at the end of which this shows that there was no difference between the people who ate red meat or didn't eat red meat when it came to cancer rates. So if red meat were driving cancer, colorectal cancer, you would see it. You should see it. If you reduce 20% of the thing that's causing cancer, you should see some reduction in cancer rates, and yet none was seen. So, and this is the rigorous evidence. So what are the limitations of this process? And this is again from David Klurfeld, who's a USDA scientist, longtime scientist, and he, one is that the panel really only looked at, well, let me back up and explain. The IARC decision came out in 2016, and they did not release the actual, they released that one-page statement from the Lancet, but they didn't actually release the whole monograph, the whole report, for 2 years afterwards. So they put out all these headlines, and nobody could fact-check them. Nobody could go back and look at their work to see what was the evidence they were actually looking at. So this came out 2 years later, and it turned out they only looked at 14 of these epidemiological studies. They not 800 as they had originally claimed. 14 epidemiological studies. Only one of those actually found a link between red meat and colon cancer, not colorectal cancer, and this was a Seventh-day Adventist study that was really quite, you have to say, confounded by the fact that Seventh-day Adventists, this is a study not only on Seventh-day Adventists, but by Seventh-day Adventists, and they believe it's a sin to eat meat. So they're just kind of proving their own religion. So that's a problematic paper, to say the least. So the majority of the IARC panel had spent the last 20 years publishing papers against red meat. That's biased. And Dr. Klurfeld said that he would sit down next to people during dinners or lunches and ask them, and he would notice that they're not eating any meat, not eating any dairy, and he would say, well, are you a vegetarian? And they would say, yes. And he said, well, don't you think that's a conflict of interest when you're sitting on this panel? And they looked at him and said, well, why? I mean, being a vegetarian, any kind of diet is a conflict of interest. But being a vegetarian when you're on a panel about meat is a big conflict of interest. And he said that was true of quite a few of the panelists and all the staff. So, and what did the IARC decide were the proposed mechanisms by which meat would cause cancer? How does meat cause cancer? Well, the main one that they use is heme iron. They say it provides too much heme iron. Okay, let's just put aside the fact that there's an iron, America is an iron deficient population. But apparently we're getting too much of it from red meat. And the way they determined this, the studies that they relied upon in the IARC decision was they looked at studies on rats that ate blood sausages. Blood sausages are 80% blood. They're not meat. Some of them don't contain any meat at all. And the only way they were able to observe problems with those rats having them get cancer is when they had calcium deficient diets. When they tested them, when there was enough calcium in the diet, the problem went away. Two other papers by the same researcher found that rats fed bacon had significantly fewer damaging compounds, but he did not submit those papers despite being asked to, and he would not talk about them. Who knows? Okay, so there was such concern about this Lancet paper or about this IARC decision that red meat causes cancer that the Lancet actually sort of walked themselves back a little bit. And they wrote an editorial and they sort of said, well, we're going to be more careful about how we go about making these determinations about cancer, because there was some sort of embarrassment about it. This is a study also by John Ioannidis, whose lecture I recommended that you follow. I mean, this is where he went into a cookbook and he randomly chose recipes and out of the cookbook, and then he looked up whether or not they cause cancer, and he found that pretty much everything causes cancer. So that's the problem with these cancer determinations. I mean, you know, coffee causes cancer, tomatoes cause cancer, everything causes cancer. So, as you know, here in California, didn't they just declare coffee cancer causing? Now it has to be on, does it have to be on Starbucks cups? Yeah. That's not going to keep me away. All right, so this is David Klurfeld. This is some of the work that he's done, if you want to take a picture and read it later. I mean, he's done some really interesting information on red meat and health. He's one of the only people who writes about red meat. Bob Lustig doesn't like him, and he can ask a question after the talk. Oh, well, we can't agree on everything. We hold hands where we can. So the disturbing thing is that even though the science is weak, even though IARC itself suggests maybe we're saying too many things cause cancer, this decision about red meat causing cancer has, you know, groups have just taken it and run with it. So, and it has real impact, right? Lawsuits to ban hot dogs, processed meats in LA schools. We have a similar proposal coming up in New York City, ban processed meats. You should provide plant-based meats in hospitals. That's kind of the flip side of that, suggesting that a meatless diet is really something that ought to be offered to people. I mean, I think that's fair just on diversity. But there's a lawsuit going on in Texas against the Texas Beef Council, saying that they should not be allowed to advertise their product as healthy because it causes cancer. That's not fair. I mean, it's not fair it's not supported by the science. So it's not supported by rigorous science. And all of us are being told not to eat red meat based on this data that is not supported by rigorous science. So what about heart disease? Let's look at heart disease. Well, there's a correlation between heart disease and red meat. Is it true that because we eat less meat now that we have less heart disease in the nation? I mean, there are a lot of reasons for why heart disease is going down. Treatment is better, statins, all kinds of, you know, there's a lot of reasons. But maybe it's also red meat. I mean, we have to be open to that idea. So let's look at red meat and heart disease. Well, first of all, you know, the reason that we came to believe that red meat is, the original reason we came to believe that red meat is bad for health is that it contains saturated fats. And this is just to show you something that you should just know, that all foods are actually a combination of different kinds of fat. So, you know, you think red meat, it's all saturated fat. In fact, a third of it is saturated fat in this particular kind of cut of meat. So just so you understand that, all foods are a combination of fats. So saturated fat was really the original reason we were told not to eat meat, and it all began in 1961 with the American Heart Association. This is the first time anywhere in the world that a group says to the American public, don't eat saturated fat and cholesterol, and therefore reduce your consumption of meat. And also low-fat milk, and that's where all that comes from, starting in 1961. Before that, we had never heard that meat was bad for health. So this hypothesis about saturated fat causing heart disease is really at the heart of my book. I really go through the whole story of how that came about and the characters involved and the politics and it's a really fascinating story. And I won't go into it now, but I will just say that that hypothesis has been rigorously tested. I mean, since the American Heart Association came out with that recommendation, governments around the world undertook really rigorous clinical trials. So that hypothesis that saturated fat and cholesterol cause heart disease is called the diet heart hypothesis. It's been tested on more than 75,000 people all around the world in different clinical trials run by governments and in experiments that last really long experiments. Really look at feeding, they would take, and I'm saying actual clinical trials. You group over here ate regular amounts of meat and butter and dairy, and this group ate soy-filled cheese, soy-filled milk, fake meat, whatever. They dramatically reduced the saturated fat content of this group. And at the end of all those experiments, so let me explain a little more. All these were in patient-controlled settings, like in hospitals. That means they would control all the food and what you eat, so it's a highly controlled experiment. You can get a good result. Most were government-funded. And the results were no effect of saturated fats on mortality or cardiovascular mortality or total mortality. And this has been covered in numerous review papers, and I can tell you where to go and look those up at the end. But this has really been a rigorously tested hypothesis, and saturated fats cannot be shown to cause heart disease. So just going back to this, so I think it's really fair to say that not eating red meat because of the saturated fat content is not an idea that is supported by data. Okay, let's look at red meat itself. Does red meat itself somehow cause heart disease in some other way? Maybe it's not the fat, maybe it's something else. This is the biggest meta-analysis that has been done of randomized controlled clinical trials. Again, rigorous kind of science, and they could not find any difference in heart disease rates between people who ate meat or people who ate different kinds of proteins. This is the only study that I know that really did that recent study. This is another one that looked at less than half a serving or less a day of meat. Another meta-analysis, and they found that it does not, and again of clinical trials, and they found that it had no negative impact on any of the cardiovascular factors. Okay, so there's just really, if you look at the most rigorous evidence, it does not show that meat causes heart disease. What about death? Maybe it's possible that somehow meat, through some other mechanism, just kills you because a vegan comes along and stabs you in the chest. No, I'm kidding. So, and most of this argument is based on these mechanisms, one of them being nitrates. Nitrates is another mechanism that people suspect is very bad for your health, and meat has, especially processed meat, has it in it. And this author here, this paper, she was one of the people on the IARC panel, just to show you. She's done 67 papers since 1995 showing that red meat has some deleterious effect on health. That seems to be her whole career. And they're all negative about red meat. Sorry, but nitrates, if you're worried about nitrates, you really should be worried about your consumption of vegetables and to a lesser extent water, because that's where your main exposure to nitrates comes from. It does not come from meat. So here's I think, an important issue of, so what? So what? Everything I've told you, I think, at least establishes that meat is not going to be harmful to your health. But why bother with meat? Like, why not just do what most, I think, magazine articles, the first sentence is, why bother with meat? And I'm going to tell you now with a very manipulative picture of healthy babies. I'm going to give you some reasons for why it might be a good reason to include meat in your diet. So here we go. This is a hard chart to read, but meat, especially red meat, is extremely nutrient dense. You get, especially in terms of zinc and iron and vitamin B12, compared to other proteins. The bottom of that list there, in terms of being nutrient poor, is chicken. Chicken has many, many fewer nutrients than red meat. Red meat is extremely nutrient dense. And if you really want to get into it, liver is the most nutrient dense food on the planet. If you can dig up some old liver recipe from your grandmother. So it has a lot of nutrients, nutrients that we are deficient in, and you get those nutrients in a bioavailable form, meaning your body is able to absorb them. It also, it also, one of those nutrients was vitamin B12. Lack of vitamin B12, especially in the womb, can really harm a baby. And there's very worrisome data about this. There are 5 times, expectant mothers with B12 deficiency are up to 5 times more likely to have a child with a potentially disabling or fatal birth defect. Women given B12 supplements during pregnancy immediately after have higher birth scores on expressive languages. Children also need B12 for their brains to develop and their nervous systems to grow. This is just facts. Such deficiencies have been linked to neurological and behavioral disorders. I'll tell you one incredibly scary thing that I learned about B12, which is that the symptoms for B12 deficiency in children is the same list of symptoms as autism. It doesn't mean they're the same, but it's a remarkable coincidence. So all these facts come out of this op-ed by Dr. Ralph Green from University of Sacramento, and is one of the world leading experts on this topic. So another reason that it's good to eat meat, it's a really calorie efficient way to get protein. If you want to get, if you want to get 25 grams of protein, you can see you have to eat 564 calories of peanut butter, or you can have 154 calories of beef. So when people tell you you can get your protein from quinoa, you can, but you have to eat a lot more calories to get it. So, so those are just a few reasons that it's a good idea to eat meat. I want to just touch briefly because I'm running out of time here. Now we're told not to eat meat because we're told that it's bad for the planet. And so, I mean, this is a whole can of worms that I can't possibly get into. But I think that, and that the general argument is that a pound of plants is costs much less to produce and is much easier on the earth than a pound of meat. But if a pound of plants, when we're talking grains really, soy and corn, if a pound of plants comes with diabetes, obesity, 75% of our healthcare costs come from these nutrition-related diseases. All of a sudden, that pound of plants looks a lot more costly than a pound of meat, which, if we can figure out how to raise it sustainably and well, that would lighten a tremendous load off of the planet, which is our illness, our sickness. So, but what we're fighting out there, and the reason you see so many anti-meat messages, is there are very, very well-organized interests really pushing those messages, mainly the animal welfare groups. The environmental groups are now pushing these messages. There are vegetarian, vegan diet doctors and experts really pushing these messages very hard. They're very well funded. Some of them are doctors, but are really animal rights activists. They're just masquerading as doctors. And there's very, Netflix films with huge followings. There's just a lot of information and campaigns out there telling us a vegetarian vegan diet is the way to go. And there is, the food industry is also involved. I don't know if, we always hear about there's big meat, but, there's big carb. That's also a thing. There's this Barilla Pasta who funds these meetings all over the world, and they have all the thought leaders there, and their idea is, the diet that's healthy is a high-grain diet, and that diet will also save the planet. Their little logo is the double pyramid, which is the save the planet pyramid and eat more grains. That's their double pyramid of health. So here's the good and bad news. Good news for meat. There really is no evidence that meat is bad for health. It's really bad news for science. We have weak science that's being repeated and promoted. It's driven not by good science, but all these activist ideological agendas and bias amongst our top scientists. But as I like to say, consensus and repetition do not make weak evidence strong. It is just the PR machine going over and over and over and over again. I also like to remind people that meat eating is ancient. Some of these are from the frieze of the Parthenon, cattle being taken to sacrifice for Athena. So meat eating is ancient. It's part of our evolution, our biological evolution. To say that we're not meat eaters is like being a creationist. Like, it's just denying our evolution. We are not, intelligent people tend to look down on creationists, and they should look down on anybody. You should not deny, we cannot deny our evolution. This is the way we think about meat now. I don't know if you can see that actual danger, tiny thing right there in the middle. And if you want to read more on this, you can read my article. My book really has the whole story of really how we came to believe that meat and saturated fat and all of that was bad for health. Part of my book was excerpted in the Atlantic Monthly, especially the part on meat. And that's where you can find me. I'm totally confused by the clock, so I don't know how much time I have. Or if I'm running into the question and answer period, probably. And this is the group that I started in Washington, D.C., because we're trying to change the dietary guidelines, because those of you who are doctors know that what you learn about nutrition in medical school comes from the dietary guidelines. The dietary guidelines is telling all Americans to eat a high-grain diet, low in meat, and that's where everybody's education comes from, and all nutritionists and all dietitians, and so we need to be getting the right information. It's like, it's not our fault, we're just given the wrong information, and we want that information, which is really a top-down model. We want that information to be right, so that people know what the actual science says. Okay, so if I haven't completely messed up the Q&A period, I think that we have some time for questions. Okay.
You've left plenty of time.
Okay, great.
Thank you very much. As a reminder, or for anyone, yes, thank you.
Thank you.
For anyone who wasn't here yesterday, I'm Betsy McMichael. I'm a family nurse practitioner and director of operations with JumpstartMD. It looks like we already have folks lining up. We'll go for about 8 minutes with questions right now.
Just one question. You think it's safe for me to go back to eating Spam and eggs? Because I really miss it.
Sounds good. Spam, 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 spam. Yeah. I think that's Monty Python. Yes, you're good.
Hello.
Hi.
I'm going to ask a question someone else asked yesterday about the study that said that a ketogenic diet causes you to live 4 years shorter.
Right.
Do you know anything about that study and why that might not have been a good study?
Oh my goodness. I wrote 2 pieces, one in the Wall Street Journal and one for Medscape on that study. Okay, so you can look up Medscape, Teicholz, and you can also look up in the Wall Street Journal, I wrote an op-ed.
Okay.
That was called the ARC study, A-R-I-C. It's an NIH-funded study. They had a 66-question food questionnaire, only 66 questions to capture all your diet. And they asked it, they sampled people only twice, and they did this they stopped doing that in 1995 and just assumed afterwards that everybody continued eating the same thing. Okay, a lot changed between 1995. And can I tell you one thing on that short questionnaire? It's a mini questionnaire. Pizza is not on there. Oops, we didn't count any pizza. So much has changed in our food supply. So it was a terrible food frequency questionnaire to start with, and the leaders of that study, I happen to know, are vegan or vegetarian, the main leader of that study. So it had some bias going into it. They don't want the ketogenic diet to be successful because it is the opposite of the diet that they have been promoting for all their careers, which is a high-carb diet. So that's the bias part of it. But the study itself the data was very, very poor. And then the group that they put in the so-called ketogenic group were people who ate up to 40% carbs. That's not a ketogenic diet. So, or maybe it was 35%, whatever it was not ketogenic. They were not looking at a ketogenic population. What they found is for that low-carb group, they saw increased mortality. But the data was so unreliable, it's not, you can't begin to call that ketogenic. And so it was, there was like 10 other problems with that study that are really quite serious. I'll just tell you one more. They decided to, so they sampled diet twice, and if between the first diet sample and the second sample, if anybody contracted heart disease or any disease, they dropped them from the study. And you know, if you're looking at a relationship between diet and disease, why would you drop the very thing you're looking at? I mean, it's inexplicable to me. That's why I bring up the question of bias in that study. I think that study is not worth anything, and it's an epidemiological study. Any other questions?
Hi, thank you so much for all of the amazing work you've been doing. I'm a big fan of your work and
Thank you.
recovering carb addict. That's my bias. Recovering.
Aren't we all?
And I'm a functional nutrition and health coach. And one of the things I tell some clients, sort of a little bit more food philosophy based, is that most studies do isolate one variable. And the problem with our diets is, you know, it's comfort to many of us. We can hardly ever isolate one thing. So after watching What the Health and Forks Over Knives and stuff, and reading some of the work by Esselstyn and you know, some of the vegan authors, I do sometimes tell clients that you can pick your poison, and studies show that you will lose weight and have certain variables if you go completely high carb and you limit saturated fat, or you can get great results from the opposite and limiting carbs. So the problem I tell folks is that high saturated fat in the presence of too many carbs for your phenotype or your DNA is the problem. And I just wonder if you know of anyone working on these multivariable types of studies that would show, i.e. carb tolerance varies, you know, this is more medical, I guess, but carb tolerance is what's individual, especially in the light of the work of Dill Bredesen and APOE3 and 4. Thank you.
Well, I think that, so I do think there is some suggestion that high carb, in the presence of high saturated fat, is possibly where you see greater inflammation and maybe problematic, right? So my knowledge of the literature suggests that if you're going to get rid of one of those, there's a tremendous volume of scientific literature saying that you will have a greater chance of success if you lower your carbs, right? There's a lot of scientific literature. I'm saying like practically 100 randomized controlled clinical trials showing the benefits of lowering carbs. I agree that there's a real tremendous range of how people respond to diets. There just is, and that's reality. But if the answer is, if the other end of the extreme is to say go very high carb and low unsaturated fats, a vegan, vegetarian diet, that may work for some people, but there is almost zero randomized controlled clinical trials showing that those diets promote health. So if you're making a science-based choice and you're looking at saturated fat and carbs, you have to, this is the science-based choice. Carbs should go down and saturated fats you can increase. You don't have to go wild with them, but I'm just saying some people respond poorly to low carb, high saturated fats. So that's something else. I mean, there's a lot of individual variation. But so I'm just driven by the science. But I know that on the level you're working with people, people have their own ideas and their passions and things they care about, and you have to be very flexible in how you talk to people and let them be on their own journey.
I'm back to the question about meat kills. I looked at that study more carefully. The study who ate 40% carbs were 65% men and 19% smokers. The group they compared with were 60% women and 4% smokers. So they expected a mortality difference. based on just male and female and smokers and non-smokers. It's a ridiculous study.
Thank you.
Can I please ask
You
a
said it for me. Yeah. Well, thank you very much.
I'm going to say she said I could ask
Oh,
my question.
I just don't want to take any of Sarah Halberg's time
Yeah.
because she is so awesome, and I think she's coming up.
We actually are in the question and answer right now, so we have time for one more.
Okay, one
Yep,
more.
that
Okay.
clock just flipped.
Hi, Nina. Ann Mullins from Diet Doctor. How are you?
Oh, hi.
Hi. In 2008, there was a study from the EPIC in Europe that found that vegetarians actually had a higher rate of colorectal cancer and compared to meat eaters. That just disappeared. And then
What do you mean it disappeared?
well, nobody really ever brings that up, that
Yeah.
there was a higher rate among vegetarians. And then at the beginning of October at the Union of European Gastroenterology, they released a study that colorectal cancer has increased 6% among people 19 to 40, which they said was unprecedented. But they didn't link that group may be the highest rate of non-meat eaters. I'm wondering if you've seen anything that actually shows we've been focusing on red meat, but it actually may be vegetables and vegetarianism that has a higher rate of colon cancer.
So the only data I can think of off the top of my head is that in all those, when I mentioned those clinical trials on more than 75,000 people, when you're eating the regular meat, cheese, and butter and all that, and you're eating the soy-filled meat, and you're having margarine, and you're having butter, and you're having fake meat, in those large randomized controlled clinical trials, one of the findings was that this group eating low meat, low fat dairy, consistently died at higher rates from cancer. It was a big finding. And it was true in almost a dozen of these studies, really big randomized controlled clinical trials. So that's not just an association, it's cause and effect. So, and I don't know what the cancer was from. Was it from the vegetable oils causing cancer? Was it from the absence of meat? Was it from, I mean, you really don't know. But you did see a very big effect on cancer. And there was so much concern about it that the National Institutes of Health had a series of very high-level meetings in the early 1980s to discuss this side effect of cancer on the diet they were recommending to the American public. And they could never figure it out.